Let's bring in Deanne from Amdal. Hello, how are you? Now, I'm not joking about that. The guy's in the bathroom every 5 minutes. Is that some kind of sign?
Well, I mean, either he has a peanut bladder, and maybe that's been an ongoing problem, but if that's something new, that's definitely could be a sign. And, you know, as you have, I don't know, have you ever had a urinary tract infection?
I don't think so. I mean, should I? Am I feeling left out right now?
No, you don't need to
Do
feel
most
left
people
out.
have them?
Well, I don't know what
are the signs?
Is. Well, first of all, usually when you're younger, like you and I, you would feel burning. You might feel yucky. You might have a fever. You know, you'd feel. But most things that people know when they're younger is they feel a burning sensation when they go to the bathroom. It's very uncomfortable, and it's
all the way through, or just when it comes out.
Well,
I thought that was a good question when I asked it. Maybe not.
I mean, our anatomy might be slightly different, but usually when
it is.
But when it's coming out, it's usually, I mean, all the way through. I'm not really sure what
that
means.
Does it burn all the way through, or does it just burn at the tip?
I don't know.
I
mean, I don't know.
I want to back up right now. Why is it so important to you that we talk about urinary tract infections?
Well, first of all, with elderly, a urinary tract infection has the potential to, one, completely change who you are, and the other thing is...
What do you mean?
Well, you can develop what's called delirium, which a lot of people think is dementia. So someone
from a urinary tract infection?
Yes, and so when someone is older and they all of a sudden start to act different, family may think it's time to place them. You know, that maybe something's happening, that, you know, they're all of a sudden demented. And that does happen quite a bit, that someone's mentation changes. They think they're getting crazy, or behavior is getting really bizarre. And really what it is it's a urinary tract infection. And
so
truly,
instead of sending them to away, just ask them, hey, are you feeling any burning?
No. Now let's back up a second. I said you and I would feel that, and people that are younger. When someone
the older people don't get the burning?
No, they don't get burning, and so they usually burning, fever, some of those same symptoms that you and I might have when we're younger. That goes away when you're older, and so that's why that they're
because sensitivity goes away.
I'm not sure exactly why it goes away, why that burning sensation's not there, but it's not. And so some of the things that you need to look for if you're caring for someone, or if you have that experience yourself, as, you know, is your urine cloudy? Does it smell? And I know that sounds strange.
Only after I eat asparagus, mostly.
And, you know, I told my husband I wanted to talk about this subject, and he said, you're really not going to get on television and talk about urinary tract infections.
No, I think it's important.
It's extremely important.
My mother used to say that you got urinary infections from too many positions.
There is some truth to that.
Is there really?
Women, when they, after...
My mom knows that kind of stuff?
Well, I don't know if it's because of too many positions, but after sex, a woman should get up and urinate after sex. And so, you know, it cleans out the urethra, and so that avoids having a urinary tract infection, so that is true. But as people are aging...
All this time I'm thinking my mom's nuts.
Your mom had some truth, but if you know, for especially a woman's anatomy, you know, as you're getting older, sometimes wiping is difficult, and so you can, you know, have chances of bacteria and have infections that way. Obviously, dehydration can make you more prone to having urinary tract infections if you're diabetic. I mean,
because you're not urinating enough and cleaning it out.
Exactly, and so, but they are life-threatening.
And this is men and women you're talking about, just not women, right?
No, yeah, definitely men and women, yeah, for sure. And so it seems, and it's hard for me to really say statistically, because in our business we take care of majority females more than men anyway. Women seem to live longer. So, you know, we see a lot more women with urinary tract infections, but it's not uncommon for men to have them either. So, you know, it is something we ask our caregivers to be alert to that. So if they, I mean, you don't want to have to go around sniffing somebody's urine, but just be alert to it. I mean, if you have a yucky smell and you didn't eat asparagus, that could be a sign. Definitely cloudy is definitely a sign. Your urine should be clear, and so whether it's a light yellow, dark yellow, whatever color it is, it should not be cloudy. Cloudy is definitely a sign of an infection.
Okay. Now, is there things that people can do just regularly to maybe not get the urinary tract infection?
I am a big believer in using cranberry. Cranberry,
It does work, right?
Yeah, yes, it does. And not everybody likes cranberry juice, but you can buy cranberry pills at nature store, a vitamin store, something
You're high
like
in
that.
vitamin C also.
Yeah, and
right?
so you can take a cranberry if you feel one coming on, or if you notice your urine's cloudy, it would be good to do that. Or if you're caring for a loved one, I would just add it if there's not a contraindication from the doctor. I would just make sure and add it to their medication box and have them take one on a regular basis.
Okay.
So, yeah, I mean,
the vodka and the cranberry is okay.
Well, I'm not going to go that far.
All right. Now, Amdal, you guys, you take care of people at home.
Yes, in their
which
home.
means that the people that sometimes get a little bit. It gets a little cumbersome for the family to take care of them, and they say, "Well, why don't we put Grandma or Mom in the home?" And let them. This leaves them. It keeps them at home.
Well, and it's little things, and then sometimes adult children don't even live near their parents,
Right.
and so we do all kinds of different things. Food is a big important factor. You want to make sure that someone's eating regularly and having good nutrition. You want to bathe appropriately. You don't want to fall down during bathing, and that is a common thing that also happens. Is people get tripped up bathing, maybe getting dressed, putting their legs in, putting the pant legs on, things like that. So that's the kind of thing our staff will assist with. And, we do all kinds of different things, helping people, taking them grocery shopping. Now around this time, the holidays, taking them out and taking them Christmas shopping.
Right.
Yeah. So
there's a lot more people out there, and it's
yeah.
harder to shop.
Oh, definitely. And I think we all need to be cognizant of the fact that, we're seeing the beginning of the baby boomers getting up there in age. And as people are aging, you have to just be more conscientious of that. I mean, there's balance issues. I mean, you don't want to be rushing in, trying to, bump somebody over that's an older person. I mean, just be conscious of it.
Okay. Now, the Amdal, and I don't remember, I think we talked about this before, but this isn't, does Medicare take care of this, or?
No, unfortunately it does not, because...
It should.
It should. It possibly should, but they don't. And they consider it custodial care, which I hate that word. And so, because they don't cover activities of daily living, and things like bathing, dressing, things like that, those are activities of daily living, and Medicare does not cover that. Medicare will cover for a skilled nurse to come into the home, but you have to have something that requires a skill. Maybe you actually have a catheter inserted into your bladder, and a nurse has to come to your home to change that. That's a skill. But having a caregiver empty your bag of urine is not a skill.
I don't think anyone wants to do either one, really, right? Now, if there's people at home that are interested in talking to you about themselves or their loved ones, how they get a hold of you?
We have our toll-free number, which is 888-798-0008. You can also read lots of information on our website if you have some questions about coverage or different things like that, and that's Amdal, AMDAL, inhome.com.
Awesome. Deanne, always good to
Thank
see
you.
you.
Thank
Now,
you.
what are we talking about next time you come in?
Oh goodness!
Urinary tract infections this time.
Yeah,
you got to bring something big.
Okay, and something that's not as, I don't know, TMI, I guess.
We'll see. All right, we're going to take a quick commercial break. We'll be back with the second hour of The Buzz. Stick around.
CentralValleyTalk.com